Welcome to the Longevity Blueprint. I'm your host, Sarah, and today we are tackling a topic that might feel a bit uncomfortable, perhaps even a little scary, but it's a conversation that could quite literally save your life or the life of someone you love. We're talking about the silent warnings your heart sends out, signals that most people, including some doctors, completely ignore until it's too late. Joining me today is Dr. Michael, a leading cardiologist specializing in preventative medicine. Dr. Michael, thank you for being here.
Thank you for having me, Sarah. It's vital we talk about this. In my clinic, I see patients every day who tell me, "Doctor, I felt fine yesterday. I went for my walk, I ate my salad, I felt healthy." And yet they are standing on the edge of a major cardiac event. The reality is the heart doesn't usually fail overnight. It sends out distress signals years in advance. We just haven't been taught how to listen.
That is a chilling thought. We often associate heart issues with sudden, dramatic chest pain, the kind we see in movies. But you're saying it's much more subtle than that. You've mentioned a 3-minute warning. What exactly does that look like for someone in their 50s or 60s?
Exactly, Sarah. The Hollywood heart attack is actually not the most common way heart failure begins. Instead, think of your heart like an engine that's slowly losing its efficiency. One of the first places we see this isn't even in the chest, it's in the periphery of the body. For example, have you ever looked closely at your earlobes in the mirror?
My earlobes? I can't say I have. What are we looking for there?
There's a specific marker called Frank's sign. It's a diagonal crease that runs from the tragus to the rear edge of the earlobe. Multiple peer-reviewed studies have linked this crease to an increased risk of coronary artery disease. It's a sign of poor vascular supply. While it's not a 100% guarantee of heart disease, if you're over 50 and you see that deep line, your heart is likely struggling with systemic inflammation or arterial stiffness.
That's fascinating and terrifying at the same time. I'm sure everyone listening is reaching for a mirror right now. But what about more physical sensations? Many people feel tired as they age. How do we distinguish between just getting old and my heart is failing?
That's the golden question. Age is the most common excuse for pathology. If you find yourself slightly breathless while doing a task that was easy 6 months ago, like carrying groceries or walking up a flight of stairs, that is not just aging. That is a decline in your cardiac output. Another red flag is what happens at night. Are your ankles slightly swollen by 6 p.m.? Do your socks leave deep indentations in your skin? That's edema, and it often means your heart isn't pumping strong enough to return blood from your lower extremities.
It's so easy to dismiss these things. Oh, I just stood too long today, or I didn't sleep well. But you're saying these are the early breadcrumbs leading to a potential disaster in the next 5 years.
Precisely. If these signs are present, your heart is already compensating. It's working overtime, and like any machine working at 110% capacity, it will eventually burn out. But here's the hook. What if I told you there's a way to test this right now in your own living room without any expensive equipment?
Wait, a DIY heart stress test? We definitely need to dive into that. But before we reveal that test, let's look at why our modern lifestyle in the US and Europe is making these silent failures so much more common. Is it just the food, or is there something else at play? Dr. Michael, before the break, you mentioned that our heart failure risks are skyrocketing. In the US and Europe, we have access to the best healthcare in the world, yet heart disease remains the #1 killer. Why are we missing the mark so badly?
It's a combination of comfort and misinformation, Sarah. We live in an environment that is biologically mismatched for our hearts. We sit for 10 hours a day, we consume high fructose corn syrup, which inflames our arteries, and we are chronically stressed. But the biggest issue is how we view normal health. We go to the doctor, they check our blood pressure, maybe a basic cholesterol panel, and if the numbers are within range, they send us home. But normal, in a sick society, isn't healthy.
That's a powerful point. Normal for a 60-year-old in the West might actually mean having significant arterial plaque already. So if the standard tests aren't enough, how does your 3-minute warning test fill that gap?
The test I want everyone to try is the recovery heart rate test. It doesn't require a treadmill or a lab. All you need is a stopwatch and a flight of stairs, or even just enough space to do air squats or brisk stepping for 3 minutes. The goal isn't to see how fast you can go, but to see how fast your heart can calm down.
Okay, so walk us through the steps. If I'm at home right now, what do I do?
First, sit quietly for 2 minutes and take your resting heart rate. Let's say it's 70 beats per minute. Then, I want you to perform a moderately intense activity, like climbing stairs or vigorous marching in place, for exactly 3 minutes. You should be breathing hard enough that it's difficult to hold a full conversation. At the end of those 3 minutes, stop immediately. Measure your heart rate again. Then, wait exactly 60 seconds of total rest and measure it one last time.
And what do these numbers tell us? What is the danger zone?
This is where it gets critical. The difference between your peak heart rate and your heart rate after 1 minute of rest is your recovery heart rate. If your heart rate drops by less than 12 beats in that first minute, you have a significantly higher risk of sudden cardiac death in the next few years. Ideally, you want to see a drop of 18 to 25 beats or more. A slow recovery means your autonomic nervous system is stuck in fight or flight, and your heart muscle lacks the resilience to bounce back.
Less than 12 beats? That sounds like a very small margin between safety and danger. If someone listens to this and realizes their heart only drops by 8 or 10 beats, should they be panicking?
Panic doesn't help the heart, but urgent action does. A poor recovery rate is a loud siren. It tells us that your heart is under immense physiological stress. It could be due to hidden blockages, or it could be that the heart muscle itself is thickening and becoming stiff, what we call left ventricular hypertrophy. This is the stage where we can still intervene.
I'm thinking about all the people who might fail this test. It's a wake-up call. But Dr. Michael, we often hear about silent killers like high blood pressure. How does this test relate to the silent damage happening inside our arteries? If I pass the 3-minute test, am I totally in the clear?
Not necessarily. The test measures function, but we also need to look at the plumbing. Even if your heart is strong, if the pipes, your arteries, are clogged with unstable plaque, you're still at risk. And here's the scary part. Most people think cholesterol is the only thing that matters. But have you heard of the calcium score, or ApoB?
I've heard of cholesterol, but those others sound like a different language to most of us. Why are doctors not talking about these more often during our annual checkups? Dr. Michael, you just dropped 2 terms that I think 90% of our listeners have never heard in their doctor's office: calcium score and ApoB. If these are the keys to knowing if our heart will fail in 5 years, why are we still just talking about good and bad cholesterol?
Because the medical system is often 20 years behind the current science, Sarah. Measuring LDL, the so-called bad cholesterol, is like counting the number of cars on a highway to predict an accident. It gives you some info, but not the whole story. ApoB, or apolipoprotein B, measures the actual number of particles that can get stuck in your artery walls. You can have normal cholesterol, but a very high number of these dangerous particles. If your ApoB is high, you are building plaque every single day, regardless of what your total cholesterol says.
So we could be walking around with a perfect blood test, but still be a ticking time bomb. That's terrifying for anyone who's been diligent about their health. And what about the calcium score?
The coronary artery calcium, CAC score, is a quick CT scan that literally looks for scars or calcium deposits in your heart's arteries. It gives you a score from 0 to over 1,000. A score of 0 means you have very low risk in the near term. But if you are 55 and your score is 400, you have the heart of an 80-year-old. You have active disease. This is the 3-minute warning from a radiological perspective.
It feels like we are peeling back layers of an onion. First, the physical signs like the earlobe crease, then the functional test with the heart rate recovery, now the internal plumbing check. But let's talk about the why. Why is this happening to us? Is it just the burgers and fries, or is there a silent culprit in our daily routines?
One word: inflammation. Your heart isn't just a pump, it's an organ that sits in a bath of your blood. If that blood is full of inflammatory markers from chronic stress, lack of sleep, or hidden sugar, the lining of your arteries, the endothelium, gets damaged. Think of it like sandpaper rubbing against the inside of your veins. When that lining is damaged, the cholesterol gets trapped. The calcium moves in to patch the wound, and the artery narrows.
Sandpaper in the veins. That's a mental image I won't forget. And I think many of our listeners in their 60s feel that stress. They're caring for aging parents, worrying about retirement, or perhaps dealing with their own health anxieties. Does stress actually physically damage the heart muscle, or is that just a metaphor?
Oh, it is very physical. Chronic stress floods the body with cortisol and adrenaline. This keeps your heart rate elevated and your blood vessels constricted. Over time, this leads to stiff heart syndrome. The heart becomes like an old, dried-out rubber band. It doesn't stretch and snap back, it just gets brittle. This is a leading cause of heart failure in older adults, even those with clear arteries.
So we've painted a pretty dire picture. We've got sandpaper blood, brittle heart muscles, and silent markers that most tests miss. But here is the pivot point for our listeners. Is this process reversible? If I find out today that my heart is in the danger zone, is it a death sentence, or can I actually turn back the clock?
It is absolutely not a death sentence. The heart is incredibly resilient if you give it the right tools. We can stabilize plaque, we can improve arterial elasticity, and we can strengthen that brittle muscle. But you have to stop doing what's killing it first. And no, it's not just about eating less fat. There is one specific mineral that 70% of people are deficient in, which is the master regulator of the heart's rhythm. Do you know what it is?
You're talking about magnesium, aren't you, doctor? I've heard it called the miracle mineral for sleep, but I didn't realize it was the master regulator for the heart as well.
Precisely. Magnesium is responsible for over 300 biochemical reactions, but its most important job is managing the electrical system of your heart. Without enough magnesium, your heart cells can't relax. They stay in a state of semi-contraction. This leads to palpitations, atrial fibrillation, and eventually heart failure. For my patients over 50, magnesium isn't just a supplement, it's an insurance policy.
But go into any health store and there are 10 different types of magnesium. Magnesium oxide, citrate, glycinate. It's overwhelming. Which one should someone take if they are worried about their heart health?
For the heart specifically, magnesium taurate and magnesium glycinate are excellent. Taurate is particularly beneficial for cardiac function because taurine itself acts as a protective amino acid for the heart muscle. But here's a warning. Do not just start dumping supplements into your system without checking your kidney function first. Everything in the body is a balance.
That's a crucial reminder. We're not just talking about popping pills, we're talking about a targeted strategy. Aside from magnesium, you mentioned a food in your kitchen that could clean out arteries faster than we thought. I think everyone is dying to know what that is. Is it garlic, turmeric?
Those are great, but the real powerhouse, and science is backing this up more and more, is vitamin K2, specifically the MK7 form. Think of vitamin K2 as the traffic cop for calcium. Without K2, the calcium you eat or take in supplements ends up in your arteries, causing that stiffness we talked about. K2 takes that calcium out of your arteries and puts it where it belongs, in your bones. You can find it in fermented foods like natto, certain aged cheeses, or high-quality supplements.
So it's not just about avoiding the bad stuff, it's about strategically adding the navigators that tell our body where to put nutrients. That feels much more empowering than just being told, don't eat this. But what about exercise? We're told to do cardio, but for a 65-year-old with a high risk score, is running a marathon really the answer?
Absolutely not. In fact, excessive endurance exercise can sometimes increase heart scarring in older adults. I recommend Zone 2 training. This is steady, low-intensity movement where you can still talk, but you're huffing a bit. Think of a very brisk walk or a light cycle. Doing this for 30 minutes 4 times a week trains your heart to be more efficient at burning fat and managing oxygen. It's about building a bigger aerobic base, not just beating your heart into submission.
Zone 2 training. It sounds sustainable, which is key for our audience. But what about the 3-minute warning? If someone did the test we talked about in part 2 and their heart rate only dropped by 5 beats, they are in the red zone. What is the very first thing they should do tomorrow morning?
The very first thing? They need to book an appointment with a cardiologist, not just a general GP, and ask for 3 specific things: a high-sensitivity CRP test to check for inflammation, an ApoB count, and a discussion about a calcium score. Don't let them tell you you're fine based on age. Demand the data, because once you have the data, we can create a roadmap.
Demand the data. I love that. It's about being an advocate for your own longevity. But as we move toward the final part of our show, I want to touch on something we often neglect: the broken heart. We've talked about minerals and exercise, but how much does our emotional state, loneliness or grief, actually contribute to that 5-year failure window? Dr. Michael, we've covered the earlobe creases, the 3-minute stress test, the hidden blood markers, and the power of magnesium. But as we close this episode, I want to talk about the heart in a more emotional sense. In the US and Europe, we're seeing an epidemic of loneliness among the elderly. Is Takotsubo or broken heart syndrome a real medical threat or just a poetic expression?
It is 100% a clinical reality, Sarah. Takotsubo cardiomyopathy is a condition where the heart muscle becomes suddenly weakened or stunned by extreme emotional stress. But beyond the acute cases, chronic loneliness is as damaging to the heart as smoking 15 cigarettes a day. It keeps the body in a state of high alert, which, as we discussed, causes that sandpaper damage to the arteries. You can take all the magnesium in the world, but if you are living in a state of isolation and chronic anxiety, your heart will feel it.
That is a staggering statistic. Smoking 15 cigarettes a day? It really puts things into perspective. So for our listeners who are perhaps feeling that isolation or who are worried about their heart's future, what is the heart longevity protocol we can leave them with today?
Let's summarize it into 4 actionable pillars. First, awareness. Look for the signs: the earlobe crease, the swollen ankles, the breathlessness. Do the 3-minute recovery test once a month. Second, advanced testing. Don't settle for normal cholesterol. Get your ApoB and your calcium score. Know your numbers so you can act. Third, targeted nutrition. Focus on magnesium and vitamin K2 to manage the traffic in your blood. And fourth, movement and connection. Engage in Zone 2 exercise and, just as importantly, reach out to someone. Community is a cardiovascular nutrient.
Awareness, advanced testing, targeted nutrition, and connection. It's a holistic approach that feels manageable. Dr. Michael, if there is one person listening right now who feels like it's too late, maybe they've already had a minor scare or they are quite elderly, what is your final word of hope for them?
It is never too late to improve your vascular health. I've seen 80-year-old patients improve their arterial elasticity and their heart rate recovery in as little as 6 months of dedicated lifestyle changes. The body wants to heal. Your heart wants to keep beating for you. You just have to stop the sandpaper damage and give it the building blocks it needs. You have the power to rewrite your heart's story for the next 5, 10, or 20 years.
The body wants to heal. What a beautiful note to end on. Thank you, Dr. Michael, for pulling back the curtain on these silent warnings. And to our listeners, your heart has been working for you since before you were born. Maybe today is the day you start working for it. Check those earlobes, do the stare test, and take that first step toward a longer, more vibrant life.
My pleasure, Sarah. Stay proactive, everyone. Your heart will thank you.
Thank you for joining us on the Longevity Blueprint. If you found this episode helpful, please share it with a friend or a family member. You never know, this might be the 3-minute warning they need to hear. We'll see you in the next episode. This podcast is for educational purposes only and does not substitute for professional medical advice. Always consult with your healthcare provider before starting any new supplement or exercise regimen.